Welcome, friends, and thank you for tuning in to another episode of the Optimal Health Program. We have our wonderful Saturday here today. We have our great Rumble LFA gang, LFA crowd.
Let's go.
Listeners here today. So I want to speak to them. Haven't spoken to them directly for a little bit, but we're here to take your calls, comments, questions. Certainly give us a hoot, give us a shout from LFA. We'd love to chat with you as well. All our other platforms, YouTube, Facebook, Instagram, Spotify, and all the other 19 or 20 of them. So we'd love to chat with you. So we're here to do that. Any questions on any topic, I would be more than happy to talk about, as you know, because I'm not a stranger to talking all day. As I do with my patients, forgive me a little bit for the raspy voice, which you'll always seem for me to have because I come here after seeing patients.
Well, that's a nice mug, Doc. I think I got to zoom in.
My new favorite mug. Please zoom in on that. It's our Charlie Kirk Patriot mug. Whoa. So I think there's a great deal to be said about a terrific person and a scenario that I'm, completely angry about. And we've been talking about this for the past couple of weeks on each of the programs. It's just a horrendous scenario, a world we live in has to change. It's unbelievable that you can't have dialogue with people anymore, and they just take it off to the extreme and lose their minds over things. The other thing that I, saw today is that there are women who are pregnant who are defying just the idea of people saying you shouldn't take Tylenol because it may be risky. And when you take Tylenol, if you're pregnant, it may increase your risk of autism. So they decide to take a bunch of Tylenol, and now some of them are in liver failure. Part of me says people can't be that stupid. You can't be that ignorant that when you're pregnant and you want to really protect everything you eat, organic, best foods, best exercise, best everything, best thoughts, all sorts of good things that you want to create while that little baby is developing inside you. And they decide to lash out at the recommendation to avoid a medication and now putting themselves and the baby at risk. It's just insane. People talk about derangement syndrome, et cetera, and people talk about being vehemently on one side of the political realm and the other side, etc. That's just beyond. That just makes no sense. Every physician in the world, I think, is just shocked at what some people will do because they just want to be angry at another political point of view. I don't get it. I just don't get it. I understand people wanting to have autonomy and the decision to do what they want, etc. I get that part. But taking that kind of health risk without looking at it first, it's ridiculous. We spoke about this the other day about maybe chemicals, pesticides, plastics, all the different things that come in foods that are bad for us. We know that it damages the brain, it affects anxiety, depression, all sorts of things. So maybe something's been occurring in the past few generations and over the past few decades that's taking away that secondary thought, well, maybe I shouldn't, or maybe I should, calm down a little bit, or maybe read about this or double check this. You just don't see that anymore. People are just going straight 100 mile an hour, crazy, but it's just damaging to your family and to the people that are around you. I don't understand that.
It's insanity. And I just want to let the LFA audience know that we are live right now. This is Saturday. This is 2:40 Eastern, and we are live. So you could ask any questions you want. We have the phone number that I'm going to pop up on the screen. We were running replays before, but we are live right now. Any questions you got? Medical, we're going to be getting into the
or otherwise. We'll chat about everything. So, Yeah, we're going to talk about everything, pepper in some medical information because I think it's important for people to hear about these things. And then talk about, as we've been saying with Charlie, the best thing you could do is gather your family, your friends together, be strong, be the best version of yourself, be the healthiest version of yourself, read a lot. If you don't know enough about something, admit you don't know and learn, because that's the key to being healthy and having a great future is great knowledge about everything that you're involved in. You know, it's been so touching to see how many people are involved in vigils and memorials all over the world. I didn't expect that. I didn't think that the phenomenon, the reach was that wide, but South Korea, New Zealand, Australia, all over Europe, everywhere, people are reaching out, and having vigils for Charlie and describing their condolences and such. It's wonderful. And I mentioned this the other day. It may be that he's going to be the person that brings more people back to the family, more people to good values, more people to God than almost anybody in history. It's in the millions already. And it's continuing to grow and grow. So although that's a terrific outcome, it's still a horrendous stain upon, our society and what's happening. But I think we're going to learn more and more about a variety of different things that are cover-ups than that are being hidden. So I think more information is going to come out. I think people really need to keep watching this and understand what's going on. Let's talk a little bit about stem cell therapy. We've spoken about this many, many times, and over many years, I've done this on many thousands of patients. Some great studies pop up. I get online, copy them down, read through them. There's a great study about autologous mesenchymal stem cell, your own stem cell therapy, for chronic heart failure and dilated cardiomyopathy. A lot of people have heart disease and heart failure over many years. And the way that I describe it, and to a patient today, I said, if you take any individual, 100 individuals, and they have no medical problems whatsoever, and you track them and you see how they age over time, from 20s to 30s to 40s to 50s, 60s, 70s, 80s. The reason our bodies change is because we're losing new cell production, which would normally help to make our organs work well or best and make neurotransmitters for your brain. And brain communicates with your entire body, make hormones in all of your tissues. Receptors get the signal. The organ itself does what it's supposed to do. And our young functioning self, which we feel, and in many cases are, as we're invincible, in our teens or 20s, the high level of repair is just staggering. So that's what keeps us strong and able. As we get older and we're losing the new cell production and losing neurotransmitters and losing hormones, the tissues change, the organs change, and aging occurs. You can see it visibly on the outside, but you don't see it on the inside. That's why we do specific testing to mark the changes. Your kidney function can decline, heart, plaque in the blood vessels, rigidness of what should be nice, stretchy, softer blood vessels, etc. So we talk about doing things to kind of fix, but the traditional approach is here, take a med for cholesterol, and even though that may lower that one number, it's really bad to wipe out CoQ10 because you need that for everything going on inside your cells, which is a little universe of activity. You need the CoQ10 for contraction of your muscles, and your heart's a big muscle. So if you're taking just a medication for cholesterol, you're making your heart muscle weak. We typically look at echocardiograms to see if we can show that. And if we do, we've got to get the people off that med, get them back on lots of CoQ10, et cetera. So there's a lot to look at. And when we talk about organ changes and aging, we also talk about putting new cells on board. That's what stem cell therapy does. And that's why this study and many, many thousands, even millions of studies on stem cell therapy describe the benefits of putting your own cells back in play, let them get to the areas of damage and degeneration and make brand new cells. Whether it's heart, lung, liver, kidney, pancreas, gut, eye, brain, etc., all the different areas of your body. So this is a great study, pretty long study, but I only usually print up 4 pages, including the abstract, which it talks about cases, case discussion, what they were looking for, and then the conclusions of what's, occurred. Here, the study talks about intravenous stem cells improve the systolic function, the contraction of heart muscle, and certainly can be a positive therapy in those that individuals that have heart failure. So something that is without risk or side effect would be your cells. All medications have side effects, but your cells do not cause you damage in any way, shape, or form. And as we've talked about this extensively, and I'm sure we have some new listeners on our LFA group, your own cells from your body are the best things that you could utilize to help to repair yourself. We do it for MS, Parkinson's, Alzheimer's, stroke, COPD, diabetes, erectile dysfunction, liver, kidney, heart failure, lupus, rheumatoid. The list, pulmonary fibrosis, goes on and on. Joints, arthritis, ligament, tendon, cartilage tear. So this is a wonderful option. It enables us to really maintain good function and integrity in the body. And there are some people who come in to do it have no medical problems, and they just want to have younger and better functioning organs. And the proof of this, a lovely lady who lived to 102, her great-grandfather was John Deere. She would come in once or twice a year, and she played golf into her 90s, and she had some aches and pains, but she was undaunted. She went out and did her thing, and she owes a great deal of her, and would describe this, her benefit and her longevity, to STEM. So these are the things that we talk about, not loading people up on tons of meds and then watching them get worse on tons of meds.
I'll just say, we got some people talking, a lot of people just saying, hi, Dr. Chris.
Hey, guys.
They missed you.
And gals.
And we got just some people saying, keeping the Kirk family in my prayers. We got Charlie was the best of the best communicator of his generation and maybe of ours as well. This is no small deal. The left created the atmosphere for hate and then tries to ignore that. It's their fault.
I agree with
Shout
that
out.
1,000,000%. One of the reasons that everyone's so mad is because if you watch, his videos, he gave people that disagreed with him and hated him an opportunity to talk and to put their point across. Then he would give them a very fair and comfortable and polite answer. Even when people were rude to him, he would give them a fair answer, a polite answer, and create the dialogue. It's the greatest thing that you could do between people that don't know each other or maybe don't like each other. The dialogue is the most important part, especially when people have significant differences in opinion. Now, yeah, people are brought up one way and people are brought up another way, depending upon what the family environment was like in terms of how you were brought up. Some people brought up conservative, other people brought up more liberal, but human rights are human rights, and caring about someone and thinking of a person who's got a wife and a family, etc., that for some reason is just obliterated by one group of people. They don't care. And they get on, they talk about, hate and everything else. There was no hate, ever. In any of the things that I had seen him do, nothing. On purpose, he went out and he did great things. So one group of people, and hopefully a very small group of people, has become so irate and so vicious, they're kind of showing their colors. And a lot of people who are in the middle of the road are now shifting away from that because they say that's insane. Unfortunately, there are people that shift away from these, horrible comments or horrible acts. But, you never know what's behind the scenes or in the minds of people who commit murders or killed that young, beautiful girl on the bus. What's the point? Is your life going to be better because you did that? Does a person think that their life's going to be better or they have to make up for something? How would you think your life's going to be better taking a father away from his kids and taking a man away from his wife just because he's talking with people? There's a great deal more evil going on where people are going out and they're killing people, and you just decide to attack this guy. It's infuriating.
We got this one. Video and camera footage are supposed to be everywhere these days. Why haven't we seen clear video of the shooter going up the rooftop? Where's the footage?
Yeah, so, you're preaching to the choir. I'm a stickler for detail as I am at work, and what I do with patients, but there's no videos of him carrying a gun, no videos of him apparently getting in and up on the roof. There's no video of taking a shot. When the shot was fired, this guy got up at the moment the shot was fired and was running away even before anybody could really stand up. And they say he broke down the rifle and then ran and then put it back together and he put it in the woods. It just, none of this makes any sense. Makes zero sense. It's ridiculous. And there's no way on earth the rifle that they showed, a 30-06, would have done what happened. That's a gigantic rifle to kill a very large animal, and that wouldn't have left a little hole and a little amount of debris field. And then why was the debris field walked all over and not closed down, for a CSI evaluation? So everything is untrue about what I've seen, And there are people on social media that are going all over the place, which I don't know is factual and necessary. But I think Candace Owens and the people she's working with have done a really good job because they brought out information that no one else wants to talk about. They want to shut it down, wrap it up. One guy, just like Oswald. And now I saw something, and we spoke about this, that said there's a picture that they believe is Oswald near the shooting, so he couldn't have been the shooter, up on the 6th floor depository. So, I think that there are a lot of people today that are a lot more aware, a lot smarter than we were maybe in the 60s, questioning a great deal more, looking in the entire picture way more than ever before. So there'll be more and more information coming out.
Yeah. And I see Michael Gross in the chat. You said this man on top of the roof was not the shooter, definitely someone else. And I'll just say, me and Dr. Chris were with each other shortly after this happened, and it was like, is that the angle?
Couldn't be. Yeah. Just to give a little tidbit because you brought it up.
We're safe on Rumble, Doc. Don't worry.
Okay. A straight ahead shot that hits the neck, all soft tissue, a bullet that big and that powerful would blow out a big hole in the back. You'd see it. You'd see material and debris hitting the back of the wall. I know. I've seen it. I've gone to places and have used those guns just to shoot and see what it's like, gun range. Extremely powerful. There's no way that small opening, that small amount of blood that came out, and nothing behind, that's not a 30-06, just not humanly possible. And there's no bone in the world, I don't care if you're a dinosaur, that's going to stop a massive bullet traveling with that inertia, that momentum, that cavitation, because when things hit, and you've seen this on some of the videos, if you look for them, look at 30-06 and how it hits a gel block or a piece of wood or something. The cavitation, that gel block makes for a great deal of damage. So, and that's typically not a sniper's choice. Small caliber, and you could look back at this in history when people are shot at close range, small caliber, the bullet rattles around, it does the greatest amount of damage. So to me, when I first saw it, and then recently seeing some other information, I think it came from the right side. It went right below the ear where it's supposed to, miss the skull, hit the spine, push out the side, and it may have come out that little hole, and that was the exit wound of a tiny round. I think that's the one that makes most sense. Besides the fact that there are different people that said they heard the shot, they looked to the left, which would be the right of Charlie Kirk. But everything makes no sense. If it were for one or two things, I'd say, but everything makes no sense. Kid didn't have a rifle anywhere. He took it apart. He put it together. He changed his clothes. He put it together. The email or the text he has back and forth with Fluffy or whatever the kid's name or, thing is.
Who's now gone.
What he likes to do.
They said he's gone. The neighbors reported
of course.
The mail stacking up. Probably in Mexico.
They found the gun in a field, but it really was up against a chicken coop or something like that next to a building that was empty, that was owned by the college.
Yeah, I saw that.
All these different things adding up make no sense. And you see guys that are Army veterans and tactical guys saying, there's no way that was a 30-06.
And a good point of the guy took the gun off. He ran all the way off of the roof with the gun, knowing he's going to chuck it in the woods and it's going to be found anyway.
Place it in the woods up against a tree. He didn't throw it in a lake. He didn't do anything, that a normal, scared, anxious person would do. I don't buy that for a minute. I don't buy any of the things that are commented on, through that. And again, you stop the crime scene. There's no CSI crime scene evaluation. You need to look for, fragments or the bullet. You need to look at the camera behind Charlie. You need to look at everything, and they just It wasn't done. It's also pretty weird. A guy jumps on the table, slides across, another guy's there, two relatively young guys, and they're just handing something and putting in the guy's pocket and then walking away as Charlie lays there on the ground.
That was weird.
I don't get that. I don't get why somebody wouldn't. Of course, they're frazzled, but somebody wouldn't try to put compression over the area on the neck or
hide under a table with live fire going.
I don't know. It doesn't make any sense. We spoke about it. I made some notes about it yesterday.
Someone's just talking about in the chat. Of course, they left the screwdriver that has the DNA on it. Like, okay.
Yeah, that's another good one. What are you going to do with the screwdriver?
I have a gun, and the screwdriver ain't
nothing to do with the screwdriver. You think people are stupid enough to think the screwdriver is what he used to, dismantle the gun, but then he put it back together to put it in the bushes? The other thing that I was talking about yesterday was that if you have to bring a gun somewhere, you want to hide it, and you do dismantle it, when you put it back together, you have to sight it back in because it's not going to have the same accuracy. So that's a lie. The screwdriver thing is a lie. He didn't have time to break it down before he ran because it would take a long time. You'd have to be a gunsmith to do that. And in doing that, you put the gun back together. Why? Why would you put the gun back together and leave it back together in an area where someone could find it? Why don't you just leave it broken down, which, of course, that never happened, but why don't you just leave it and run and throw it in a lake or, dispose of it somewhere. Take it 100 miles away.
Make it harder to find.
You want to minimize your ability to get caught. It doesn't make any sense. It's just, it's nonsense. Why would you do that? And why would you write stuff on the bullet and everything else? It's almost as if someone's making all that happen when, there was no reason for that to happen. Also, the kid that they saw, which I think his name is Sky, on the closed circuit TV in the building with a hat is not the kid Tyler that they've arrested. There's two different kids. They may look alike. And why, when he's climbing down the building and there are cars all over the place, do you see him climbing down the building, not one person running away to get to their car to leave? From the shooting scene, people are scattering like crazy, right? There's nobody in the parking lot running away. He runs across another parking lot, nobody in the parking lot running away. At one point, there's some person walking slowly the opposite way in the parking lot. This is just all,
it's almost like it was another day, that whole surveillance.
Yeah, well, there's no timestamp on it. So if you really want to play detective, which I like to do, by the way.
We all do, Huck. What do you think? Because people are asking in the chat about it being an exit wound, as you mentioned, the lawn.
Yep. Definitely small bullet exit wound.
Can you explain? Because you were telling me about the pressure of a bullet going in.
So when a bullet goes in, it's a clean opening the size of the bullet. So if you were to take a pen and hit through the paper, the opening would be the size that the bullet needed to get through the paper, because it's moving way faster than that material. And that material, even though it's soft, has a little bit of resistance, but it goes right through. On the other end, the cavitation, big opening, big hole. So there was no such thing as a 30-06 involved in any of this. If you hit from the front, you go directly back. Anywhere in the front, you go directly back. If you hit from the side, you go to the side. JFK, same thing. Hit from the front, head goes back to the left. Just obvious. Anybody who knows physics would tell you that. So I think that the idea was to create a shot that was going to be as devastating as possible, which would be, the assassin's shot behind the ear, hits the cord, your body tenses up, you go decorticate because now the cord has no communication with the brain. So he felt and sensed nothing in any way, shape, or form. So arms come up, legs turn in, your body tilts, but the movement of the pressure from being hit on the right side tends to make you go to your left side. And then that little opening was the exit wound from a small
We have someone that
round.
That disagrees. So
Well, you can disagree. Let's get some Army vets out there, guys who know ballistics. And because I've watched a whole bunch of them, and that's
Yeah.
their comment. So
Have you been have you? I know you hunt a lot, or you more casual, not every day. But do you use the 30-06 much with hunting?
most people that go hunting for big game will use a 30-06 or a 338 or a 300 Weatherby. You know, with target practice that I do upstate at a wonderful club that I belong to, they have a 300-yard range. And, you know, it's not easy. It's not easy to hit a shot at distance unless you know exactly what to do every moment. And you have to get your sight on. You have to take a deep breath in. Once your breath is released, you can then very slowly squeeze the trigger. Some people like to use the tip of the finger. Some people like to use the middle pad of the finger. But it's not an easy shot unless you practice a great deal to hit something at that distance. The sound of that shot on video is not a big caliber gun. It's a smaller caliber gun. You can hear that. And we mentioned yesterday, listen to the sounds that they've recorded from the Las Vegas shootings. You hear big guns, and then you don't hear that with this round. So
Yeah, someone's suggesting 300 Winchester mag, 180 grams.
that's just too big.
Yeah.
That could take down a moose at like 300 yards. A 300
Oh, wait,
win
maybe
mag.
that wasn't a suggestion. They're just
Well,
talking about
no,
hunting.
yeah, I mean, no, I love it. I love the comments. And a 300 win mag is a monster shot. You know, I know friends that have gone for elk and all these big things out west. I haven't gone, but, you know, they typically love that 300 win mag. I mean, it's a cool name, but the 300 Winchester Magnum is a huge shot. I mean,
And I'll just say to the chat, when I was young, my first gun going into Dick's Sporting Goods, back when you could just buy a gun in New York, now it's a bit more pain, but my first gun was a bolt action rifle, and I wanted a 30-06 because I just thought it was a cool round. It sounded great to me, and I didn't know anything about guns. Then I went to do, training
Sure.
on it. But my biggest mistake was, why didn't I get a 22? This thing hurts. Like it's
of course.
it's so much power. It's not necessary.
For people that are hunters that use that, it's probably the most versatile round to use for, big game. There are bigger. There's a 475 if you want to go for bear, 500, which will take your arm off just as easy as it'll, hit the bear and knock it down. But 300, 338. There are a lot of different rounds. 7mm. These are all heavy duty rounds, and you're going to pay for it. You can't go to the range and shoot 5 in a row.
No.
You'd kill your arm. Your shoulder would fall off. So once you get it sighted in and you put a cushion there and someone's watching to see your accuracy and adjusting on the scope, et cetera, those are just way too big. It's just not, it wasn't used at all for this.
Yeah, someone's talking about just no towel over the gun. Yeah, I didn't see it. I was also wondering because I can't shoot anything without a bipod with one of those bolt action rifles. But I guess he could technically use the towel as a support to lay it. But it's like, would
No
you?
chance.
Would you?
You couldn't use a towel. Towel's too soft. You'd have to use something hard that's not going to fluctuate or move or bend. Because remember, an inch worth of change at the gun is a foot worth of change at the other end of
barrel.
The
target.
anticipated target. So there are people that have sandbags when you go out to a place to shoot, and you can nestle in on the sandbag, but the sandbag is just, you kind of mush your gun tight into the sandbag so that, and there are little things that pop down off of the gun, like a little bipod that will hold it in place, but yeah, no one's doing a shot like that, freehand. It's just no way. You see some of these guys, and I did a wonderful course. I went down to the Marine Corps Executive Forum, which was a really amazing day. I was telling you about this the other day.
Yeah.
We had dinner. The Marine Corps Executive Forum is set up by the Marines, and civilians, once you're approved, can go down there, spend a day with the Marines. You go and you see all the monuments. It's unbelievable, very patriotic. They take you to the Pentagon. You walk in, you see lots of people. Colonels will come over and talk with you. A general will come over and talk with you. You shoot the guns and rifles in the field. You eat the rations with them. You go to Dunn's Tavern with the guys. They talk about their experience. We went up on the Osprey crazy helicopter thing, which was pretty awesome. At the end of the day, they have a marching band that goes back and forth, and we ended up meeting the commandant at the time, who was Dunford, and he became the chairman of the Joint Chiefs of Staff. Very, very nice guy. But, wonderful thing to see. But you ask any of the guys that do this, for their career, their lifetime, they'll tell you everything that I just said.
Yeah, I haven't seen any ex-military talk about this topic and be like, oh, this narrative makes sense that they're giving us.
No.
Not one. I'll take it. Anyone, talk in the chat.
It's a quick, wrap and push it under the rug and try to get it done.
Yeah, people are talking about elk, deer, moose, coyote, 130 gram. Getting us in the mood.
Got some hunters here. That's good. Look, I believe it, and I believe it's fair. And I think people like to hunt. You should eat whatever you shoot. And most of the people I know do that. I have friends upstate at this club, and took his son out, 17-year-old son. They went out to Montana, shot a big elk, brought it back, and this is a terrific guy, and his son's an awesome kid. I mean, the nicest, straight-laced, God bless him, forward kid. And they brought it back, and they had it butchered, and they just fed everybody at the club. They're just, the nicest people. And let me tell you something, elk meat tastes terrific. Tastes better than steak in many cases. So, yeah. But you have to understand, what's used and why things are used.
Got one more over here that I could actually comment on because I own this product. So Tony Pfizer says, I lean more and more towards some kind of device attached to his microphone. The large bullet entry wound with no exit wound just makes no sense. So the one thing about the microphone, because I've seen theories and people say maybe there was a device built into the microphone. I own those microphones. And couple things that would make me think maybe not is that it's a magnet, right? So there's a magnet on one side, and it's not very strong. I mean, it'll go through any force going this way. What is it? Newton's third law of motion or whatever it is, but equal and opposite reaction. If you're going to shoot something out of a device, the device would go the opposite direction. When the shot happens, the mic kind of goes towards it. And then
there's no.
And the one other thing is that magnet would not hold on if there was a charge in there.
And there's nothing you could put into there that would be, significant size for somehow get and transect the spinal cord so that immediately he would become decorticate posturing. So there's nothing in that little magnet, even though it looked like it moved with the shirt, etc. There's nothing you could put in that magnet that would get inside, transect it, go back, and it's just...
Yeah, and it's so easy to move that thing around. Like, no one would just, if you're going to make sure something has to happen, you would not put all your eggs on, oh, this guy could just move the magnet at any point. Like, people get itchy, and then my clients move them all the time. That would be too crazy to risk it all on that, on an itch, That's just these are all opinions. Of course, we don't know what the heck happened. We just know that the FBI is lying to us. That's about it.
Yeah, it's pretty crazy to think that you don't really think that the most thorough evaluations are being done. And there are comments about, 10, 15, or 20 people being there as part of it. That guy, George Zinn, another kid who's standing up and waving, and just all sorts of weird things going on. But, you'd like to think you'd find out, and maybe we will someday, but it doesn't look like we're going to get the information that we want.
But this was good. And listen, guys, you agree with us, you disagree with us, talk in the chat. And even if you want to give it to us and you're just like, you know what, I think they're idiots. Well, guess what? Here's our phone number, and you can call us right now live, and you could yell at us.
Absolutely.
Or agree with us, whatever you'd like.
We would always, and in keeping with the appropriate tone of the way that Charlie did things, you want to talk to people who may not agree with you, and then just have a conversation. Nothing wrong with that. That's like being a terrific athlete and, wanting to battle with the guy that you're playing against. But at the end of the day, you're friends and you hang out, Competitiveness intellectually, competitiveness physically is a great thing in sports, and that's been around for such a long time. And some of the best, look at Michael Jordan, Tiger Woods, look at these people. They're phenomenal. And they're that way because they have that perseverance to be able to be the best. But, when they battle each other, there's no fun there. Fun's afterwards.
I'm smiling because you're going to love this question. First, someone said, I think it came from behind, but only God knows. And then the follow-up is, who killed JFK, doctor?
Okay.
Phew.
Do we really want to do this?
Uh-oh.
We'll give little tidbits.
Little tidbits, yeah. We got to get into some medical.
So there are videos of JFK getting into the car with Jackie at the airport, getting off the plane and getting into the car. And then there's a Secret Service man who is supposed to be on the right side of the vehicle. There's supposed to be 2 motorcycles in front, 2 in back, 2 on each side, and then the Secret Service on the running boards. And they call the Secret Service guy off the running board, which is protocol. And he's raising his hands. Why? Well, why would I not be on the right side of the door, etc.? And there are many, many things. So if you see that the car is getting down towards the bookstore depository, it makes a left and goes down towards getting on the parkway, unless that's a kill zone, which of course it was, why would a person who's trying to shoot at somebody shoot at a car going away, getting on a parkway under an overpass where you don't have much chance to take the shots? You would take the shots coming towards the bookstore depository because then the driver either has to turn around or does something, but you have more time to take other shots if you're the assailant. The other thing which no one ever spoke about, and I'm the first person in my mind to think of this, which other people have been surprised at, 6 stories, 6th floor, bookstore depository. If you see where the X is on the street and you see how high that bookstore depository is, the angle of that shot is not a flat angle that would hit the back and then go directly to Senator Connolly in front, and that single bullet theory is the biggest joke I've ever heard. So how does that 6th floor shot come down low enough to be able to go and travel horizontally? Just couldn't do it. And there are other people that say that there are individuals in different windows. They're talking about maybe someone shooting from a different area. People talk about 4 or 5 shots, the ones they're interviewed. They got rid of all the interviews. I mean, there's more cover up with that, and probably going to be just as much as this with Charlie. But none of it makes any sense. People that heard shots ran towards the grassy knoll. There was a man in a tower at the grassy knoll and got killed because he was a witness. And people that they said were hobos were not hobos. When they interviewed people, behind the grassy knoll, behind the fence, they were all clean-cut, men and not wearing dirty shoes. And there's a lineup picture of these guys walking through. They're not. So they were probably just all operatives. The car, once the tragedy was done, was taken away immediately and disassembled. So you never had a chance to see what was going on with the car or pick up bullets or otherwise. There was a bullet found on a stretcher that was never fired from a gun. And they said, oh, that's part of it. That's the bullet. It was never fired. It's in the shell. When a bullet hits anything, especially bone, as did with Kennedy and Connolly, it's fragmented.
And the gunpowder's gone.
Yeah. It's just, who would believe that?
It's like, oh, he threw the bullet?
Also, that gun was a piece of garbage. It wasn't the guns that you might have today. That gun was a bolt-action gun. The scope was a lousy scope. It wasn't a Zeiss or a Loophole, the gorgeous scopes today that'll cost you an arm and a leg. So for someone to shoot from the 6th floor depository and have to aim all the way down at a car that's moving, mind you, and then zero in on it, chamber the round, zero in on it, take a shot. The kickback from the shot makes you lose your sight picture. You got to go back down, find it again, take a moment because your eye is trying to see exactly where in that scope you need to be. You pull the bolt back. Another one, that just not, you don't get 3 shots off in 3 seconds. It's not humanly possible. And that was proven by sharpshooters over the years. So that's a lot of nonsense. Going into, Dallas and the hospital there, and you can see some of the pictures and things of what happened and the handwritten diagrams. Even video still exists of the doctors who were there. I forget the names of some of the doctors, but you can see them talk about what happened. shot from the front, back part of the skull blew out, etc. Shot from the front in the throat, which was an entrance wound at the depiction for the surgeons in Dallas Hospital, was a Parkland Memorial, etc. The body was wrapped a certain way with a white wrap around the head. So apparently the brain entirety of the rest of the brain was either taken by the family at that time. I mean, who knows? It was probably done on the plane. And then he was in a brown casket that was a little bit, banged up from getting on the plane. Then he emerges off of the plane in a bronze casket, not a brown wooden casket. And when they get to Bethesda, he's in different wrappings in a big Ziploc, green bag. So all of this is, documented. So there are so many different things that were changed. And then when you see the report done at, Bethesda, it's a completely different report. This wound was made to look like an exit wound, etc. Things were manipulated to make it look different. But there's a great deal that, doesn't make any sense.
None of it makes sense.
And as odd as it sounds, Jesse Ventura, the
before he went totally crazy
and wrestler, he wrote a book on 63 things that proves it's a conspiracy. And if you just put all the craziness aside and you look at those 63 things, you're like, wow, these are really good questions. This does make sense. So
the chat's loving it, and we got a couple more questions in the bank.
Okay, questions, comments.
So one person just
I
says,
hope they don't mind us going off the rails here and just
dude, they love
talking about
it.
everything.
Are you kidding me? What do you mean? They're loving this.
Cool.
I mean, we're on Rumble, baby. Hello.
That's right.
What are the odds of George Zinn being involved at 9/11 and the Boston bomber and then this? No way it's a coincidence.
Yeah, there's no such thing as coincidence, especially when it comes to travesties and, tragedies and things like this. There's no way. So he's involved. He was probably a lookout. He was probably put there to distract so that whoever was on the roof, was able to run away.
And then one other question. This is an interesting one. Do you think Trump knows who killed Charlie?
I think people on the inside, and I'm sure, and Erica Kirk, has said when they asked her, and Trump asked her what she thought, and there are text messages and emails going back and forth to Candace, so they think it may have been an outside source that he disagreed with. I mean, I can't say it 100%, and it's not right for me to push something that doesn't have that much enough information behind it, but you can see there's stuff brewing that is coming internationally from another country that I think may have some bearing, because a letter of condolences was signed, before the, killing. And how did people over there know before people over here knew? How did a book on Amazon be popped up on Amazon the day before and the day of the shooting? So there's definitely widespread involvement in this. I'm not asking anybody to go out on a crazy limb and be a crazy conspiracy person, but conspiracies are real. The conspiracy theory idea was brought about when Kennedy was assassinated. And look at all the info we have now we didn't have before. Yeah. And I really think that when people are nefarious and dangerous and murderous, they think, okay, this is how we're going to do it, and cover it up with smoke and mirrors, and you're here, and you have two guys there, he runs, you yell, blah, 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 blah. And let's make a conspiracy theory to protect our result.
Right.
Shout
out to our chat. Someone just said, I wear my tinfoil hat proudly.
Here you go.
Mine's never off.
They cannot read your mind anymore. Tinfoil prevents that. You can't use it all the time, because then the aluminum exposure, because you've got heavy metal exposure.
That brings something. Yeah. There you go. See, it all comes back together. Let's talk about heavy metals. That was amazing. That was so good.
Now and then I can get a good zinger in there.
We've got a couple other questions. I don't know if you want to keep it going.
Yeah. Whatever questions you have, that's what we're here for.
IMV. what does IMV stand for? But IMV, the question that needs to be asked: who benefits for Charlie Kirk's death besides the crazy left, and would be willing to carry it out? Too many questions, not enough answers, especially
There's some pretty decent answers for that.
No, this is a separate one. This is a separate.
Yeah, no, but what I'm saying is bringing that idea up, just like who would benefit the most from JFK being killed. That's pretty obvious.
Lyndon?
You know, that's more obvious than anything. And back then, you didn't have 100 people or 100 things happening. You had something that occurred that benefited that one person the most. And things that that person may have been doing in other arenas with his buddies, with trade and whatever else, etc. So now, because there's so much money shift and this and that and all this other crazy insanity, the reality is still there are people who benefit the most because Charlie was many things. He was a great speaker. He was able to reach millions and millions of people, which nobody really knew until he was shot. I thought he was just a terrific American speaker, and people would know about him. I didn't know that it was worldwide. And I remember 2 interviews that said, "Hey, so what are we talking? Charlie Kirk for president? You know, down the road?" He said, no, it's just too much. Then someone else, Charlie Kirk for vice president, and Charlie, political career. As soon as the rabid people started to hear that, they started to freak out and say, "Hey, this guy has more of a following than anybody ever has. What politician has had this many followers before becoming a politician? Nobody. Nobody sitting on either side has that following." So he was the greatest motivator, said all the things and lived all the things that were right. So this guy was going to carry through. And if he didn't take the office, he would have helped, just as he did, with, people getting out and voting. The young population, they all gravitate to him. The young population is gravitating to him like never before, and rightly so, because of values and all of that. So that's a very dangerous person to the opposing school of thought and the opposing political realm. Absolutely. So they would have a reason. If Charlie didn't want to play along with what other people were wanting him to do and trying to push him to do from another realm, there would be a reason. Typically, regular people are not violent, but this whole process, what happened to him, was not a regular assassination. It's a military assassination.
Thank you. You took it right out of my... Someone just said, my husband has gone down quite the rabbit hole on the wife. Hey, listen, guilty as charged. You got to keep everything open. You got to look at everything, I say,
poor woman.
Poor woman. Oh, yeah.
Poor kids.
And yeah, someone's saying he probably would be president one day. 100%. I mean, 100%.
I think the tide is changing, and a lot of people are looking at reasonable versus unreasonable. And I know people that are middle of the road, and everybody, and even people talk about it. I wasn't conservative, I wasn't Republican, but, this is unreasonable. I will never deal with that party again. I will never follow or donate, etc. And foolishly, the people that did this had no idea that they woke the sleeping bear, that literally many millions of people are affected by this, and you see it. And everybody talks about it. People come into the office and they want to talk about it. And I'm sure, look, whatever you want to talk about. If you're upset, yeah, let's talk about it. But, and this is only a short period of time. Think about how this effect is going to continue to increase globally. It'll help other nations as well.
Right. The chat, you guys are incredible. I'm loving you guys. Who aren't you allowed to criticize or you'll be banned? That's who unalived him. You're good. I love it. I see where you're going with that. Wasn't the gun checked that it was fired? Honestly, all we got from the gun was a 3-megapixel photo of a gun that looked like it was taken by the first iPhone that ever existed.
Yeah.
On the New York Post article that actually first showed that photo, that article is now scrubbed. It's been
You know what's rude about that gun? You brought this up too. The sight looks like it's too far back.
right. The scope
So
is like,
if we can get a copy of that picture somewhere, somehow, I'd like to be able to compare that, because when you snug a rifle in, no matter how you're shooting it, you know, the reticle, the sight can't be that far back. Otherwise, when you shoot, you're going to blast yourself in the eye. It's got to be on the what they call a Picatinny rail, a little further up on the gun. So I just, that's position of the sight didn't make a lot of sense to me.
getting that up right now.
You know?
Here we go. Boom.
Yeah, that seems like that whole thing is just
That's insane.
too far back.
Look how far back you'd have a black eye, a nice ring around your eye.
And of course, a kid who doesn't know how to shoot that thing, you know, that's what would happen to him.
Right.
Yeah. Doesn't make sense. No sense at all.
No sense. It only gets more confusing the more you think. It's almost by design.
Well, I think people are smart, and I love LFA people. I love the Rumble people. I love people that do not just sit back and say, oh, yeah, okay, whatever. You know, we don't do that.
Right.
I wouldn't do it. You wouldn't do it. Everybody I know wouldn't do it. They're like, wait, that doesn't make sense. Let me think about this for a minute. You have to be a little skeptical. You have to think. You have to look. You have to read. You have to research. You have to ask. And anything that you do in health and medicine and fitness and anything you do, someone's going to work on your house, work on your car. Anything that you do, you have to sit down and say, okay, is this reasonable? Does this make sense? Does it not make sense? This doesn't make sense. And to think that there are people who would try to force a narrative that makes no sense onto it,
Yeah.
you know, knowing full well that everybody on social media is going to say, what are you talking about? How is that possible? And they would know that people that are tactical veterans would laugh at this and say, that's just insane.
And the scary thing I notice is like you're on social media, but anyone I talk to who only watches cable, they're like, wait, what? You think that there's a different shooter? Like, what are you talking about? Like, they don't know anything that's going on, which is like, ugh.
I think it's easy to live in a little world where you just watch one station and listen to the mainstream news because they're just telling you what they want you to believe in everything, you know, in everything. There was a funny Instagram, I think, and one of the Republicans put it out, or conservatives put it out, where it had one individual saying, oh, and as a community, we have to blah, blah, blah. Then all of a sudden, the exact same words were said by every newscaster on every station across the country. The exact same words.
Yeah.
So
Script.
It's all orchestrated, created, and they're just trying to either dumb you down or just get you angry about someone and calling him a name. And of course, if enough people call that name, well, then it's got to be, that person's got to be what the name is. So.
Yeah. And shout out to Dion in the chat. It says, we as the American public are being played, in my opinion, and I don't like it.
That's right.
I don't like it either.
That's right. As I was saying before, look at Lincoln, look at every assassination that's occurred. Because someone had a reason, and they figured out, you know, why they wanted to do it, and everything got covered up.
Crazy. Let's see what else. You guys are great today. This might be the most lively chat we've ever had. We usually talk about medical advice, by the way. For the record, this man is a medical doctor, and he's here to help you guys out with any questions you have. Just to let you know, we're here every Saturday on Rumble, but we also are on the Optimal Health Program YouTube Rumble if you want to see throughout the week.
Yep, Mondays, Fridays about 12:30, and Saturday at 2:30.
And this line is always open if you want to call, guys. It's been a while. We had so many calls, and it's been months. You guys like to talk, though. I get it. Thanks to you. Cheers to you. Cheers to you, Dion. And the Mockingbird Lying Media. Yes. Happy Abraham. I see you. LFA's the best. We question everything. Don't just take someone's word for it.
You have to. If there's one thing that you have to walk away with is that learn as much as you can on everything that you do. And that's why I tell people, I show them articles, I tell them to go read this, read that, go to Google Scholar, look up intravenous vitamin C therapy. There's 1,500,000 studies on how it works to inhibit virus, make your immune system strong, etc. And now people are questioning, a great deal that we've been told is safe, and don't worry about it. You have to. Thank God for RFK Jr. We have to get correct information out there. And the CDC admitted they covered information about the hepatitis injection at birth that they think is 1,153% increased risk in autism just from that one injectable. And why are the rates of autism so high? We're told, oh, don't look there, don't look there, don't look there. Meanwhile, it's probably the greatest, risk. So for those of you who'd like to email, you can do that for me at the website, drcalapai.com. Thank you for all your emails. We get so many of them. The Garden City office is 516-794-0404. I'd love for you to take a look at the website, look at the videos there. The new mechanism that we're putting together, vitamin packs, working extremely well, takes all the guesswork out of it. Will probably save you a decent amount of money, too, because a lot of people that go to the health food store, the supermarket, to buy vitamins and such are buying randomly things that may not correct their deficiencies. That's why we do the blood test first, make recommendation for vitamins. I do that based upon your blood test and your condition or your circumstances, and then recheck to make sure those levels are perfect within a month. But the pack is easy to do. I'll make the pack. So your pack has things specific to you, and you get a morning pack and a little clear, little bubble, and then an evening pack. So you take it, you open it, take it with your breakfast, you're done. Take your pack with dinner, go out to dinner, take that, take your supplements, eat, you're done. And you just use the packs. It's just a smarter way to do it.
And I just want to say, because I see this chat, and it brings up a very good point, because I met this man, Dr. Chris, going through COVID. You don't even, you see all of the, what the medical industry had become. And this man it reminded me, because he says, to be brutally honest with you guys, my confidence in the medical industry is at an all-time low because of COVID-19 and the shenanigans happen.
And rightly so.
Yeah. And Dr. Chris is like, I don't even know what to call a pioneer, a Viking of actually what medical, the medical industry should be.
Yeah,
and
thank you.
It's truly incredible. So you should check out the website, just see what this man does, because he's not pumping anyone up with drugs, and it's like a breath of fresh air.
We had another thank you very much, Frankie. We had another long haul COVID patient today, and we give them the overview about what happened and how the injectable is not a safe thing and meant to be able to create repair. It confuses your body because using messenger RNA from somewhere else, your body says, oh, wait, I'll follow that lead. So autoimmune disorders, turbo cancers, myocarditis, clots, all these things are happening because of that, because it was never tested. It was rushed through as emergency use. Meanwhile, when this all started, a good buddy of mine that I went to medical school, Dr. Fleischman, who's been in and out of Africa treating Ebola and every horrible bug that's ever existed, was using chloroquine and ivermectin and such. But they vilified those in the media so that they said it wouldn't work, even though it did. And they were able to get emergency use vaccine, which they meant to do this, to depopulate. Look at Bill Gates' TED conference talks talking about if we're diligent with vaccines and medications and reproductive health, which has got nothing to do with reproductive health, we can curb world population by 10, 15%. That's what he says. The videos are still up and around. They're still circulating. You could watch that at any rate. So fighting against a bug, a virus, any bug, besides thinking of something to use to try to attack the bug, because that substance is not going to give your body any other long-term benefit, we talk about doing vitamin IVs, correcting vitamins, minerals, hormones based upon the blood test, and different things we could use. For people that had really bad lungs from COVID or heart or any of the organs, we use stem cell, because you're putting brand new cells in that go to your lungs and make your lungs newer. You're putting newer cells to all of your tissues. So that's why stem is an ideal for chronic degeneration or even acute degeneration of different organs. because you're putting brand new cells in to have that organ become younger and more viable. So we've done a great deal of that, and it works, and it's important. So we talk about that a lot. The questions are also, is something really post-COVID or is it post-injectable? And people that have had 1, 2, 3 or boosters, their risk of all these things is dramatically higher than people who haven't. And that literature is coming out now. Literature out of Australia, the people that have multiple boosters have a great deal more medical problems than those people who took 1 dose.
Of course, it's coming out now. My daughter, my son, my son-in-law took it, and I fear for them, whereas myself and my wife and my granddaughters didn't take it. My son and my daughter had to take it because of their work, so I am truly concerned, and they took the shots in the early stages when it first was recommended.
So you need to have them do testing to look at clotting factors, because there are young people who clot up, and you want to see if the clotting factors are activated. Then you want to use nutrient combinations, nattokinase or cumin, quercetin, etc. And we do that. We recommend those as vitamins to patients. Once we see their clotting factor is abnormal, they have to routinely be checked every couple of months to look at the clotting mechanism. And for people who had cancer in the past that were totally free of cancer, you got to keep checking those people to see if it's going to come back, because the p53 gene, which helps your body fight cancer, is affected by the injectable. So you have to constantly check these people. It's got to be a doctor who knows what they're doing. We've done a ton of this. Some labs will do tests that are more specific to inflammation or the spike protein. Other ones don't. But you got to keep checking for some of these common problems that are created by the injectable. Myocarditis, look for inflammatory markers. The list goes on.
Might be my favorite show ever. I don't know. This might be. I think it is, Doc.
You never know.
Share this to everyone, by the way. We've honestly, it's only been since January-ish when we started this show, and would love for everyone to, be aware of the medical information. And if they do have questions, they can come see us live, and they can just write in the comments, or they can call us live, and we could answer anything you guys have, because there's plenty of BS out there.
We have a few things that we're going to try to do. We're going to put a little bit more time to doing it. We may do a lecture at the Marriott Hotel. I used to do that in the 35 years of doing radio. I would announce over the radio that I'm going to be at a Saturday afternoon at the Marriott Hotel and give a lecture. We get 300, 400 people to show up and ask questions. It was fun. We may start doing that again. So in the next couple of weeks, I'll probably announce it, maybe try to pick a date. And we might even do the podcast live from there. So it's a Saturday afternoon, easy for people to get to. It's, it's a simple, easy place, and stream it or whatever we have to do to try to get it out there so people could see it. But, yeah, we can do some of that.
We should. That would be amazing. Live from the Marriott. Could be like a UFC event.
Yeah, we'll put up a little ring. I'll get dressed up in the boxy shorts and get out with the gloves, get up,
It's going to be karate, though, guys. It's gonna be karate. Yeah. They said, I love it. You guys are sharing it. I appreciate that. This episode, so my son and daughter can watch it. There we go.
Yep. The more people I think that hear about the important concerns that are facing everybody in healthcare today. We talk about getting rid of plastic water bottles, testing for heavy metals through blood and urine. Getting rid of pots and pans or the aluminum in the antiperspirant. You've got to make your personal environment safer. Use triple reverse osmosis filtration systems in your home to really purify the water. So whether cooking, bathing, or otherwise, your water is as pure as possible. Get your exercise in every day. Do something so you're getting your blood vessels to keep opening up and getting a lot of oxygen, vitamins, minerals, and hormones to your cells. Learn and fine-tune your body. It's the only body you've got. Unless, of course, you have multiple personalities. Then it's the only body that all of you have. So
Starting to sound funner and funner, though.
That'd be a good comedy routine. Well, he's a vegetarian and I'm a carnivore. One personality's one way, one personality's the other way. Other comments that are brand new about stem cells, because I looked and I tightened the age of the research down. Talking about stem cells for regenerative medicine, besides talking about benefits to all the organs, etc., doing it for hair, because it helps to improve hair stability, growth. Same for facial rejuvenation, because we've done a lot of that, where instead of people getting Botox, we'll take tiny needles and inject the stem cells throughout the face, and you're getting brand new billions of young cells to come up, which create repair, and you'll have a much more youthful and healthy appearance. So that's another component of stem cell, a little bit more aesthetic compared to, the mechanical mechanism of a joint damage or a disease. So that's significant. And who doesn't want to have a good face and good hair? That's important. Another study on stem as a game changer in liver diseases. And this talks about cirrhosis and all these inflammatory disorders with some really wonderful comments about stem. So the literature's there. For those of you who like to look at literature, you should go to Google Scholar and in the search box, type in stem cell therapy diabetes, stem cell therapy stroke. Look at all the different disorders. You'll see a ton of info. If you want to look at vitamins, look at intravenous vitamin C therapy, and you'll see 1,500,000-600,000 studies on vitamin C inhibiting viruses, has anti-cancer effect. So the information's there. Not hard to find. But I like for people to go out and read and look. It's funny, too, now people bring me articles. I'm like, oh, cool. I missed that one.
We'll add it to the show.
Alrighty.
Oh, we're over. Look at us, 75 minutes in.
I just looked up at 75 minutes.
Look what happens.
Wow.
Listen, you guys make this happen, all right?
That's right. We love it.
Great chat today. What else we got? Con Job 19. I love it.
What's that?
They're saying instead of COVID-19, it's Con Job 19.
Yeah.
I will go to the Marriott. We got some Marriott people. Let's
Cool.
go.
We'll announce that. We'll talk about it every week. And we'll have people call the office and just, leave a number. We would do that typically in the past where how many people could bring. 4 people, great. So just add up the numbers and then we can tell the Marriott how many people or chairs we need in a room. So... What didn't we talk about? Oh, RPM. RPM's turning into be a brilliant way for people that are suffering from medical conditions to be evaluated in a far greater way than ever before. Never before has it been this intelligent. So Medicare recently has decided to cover remote patient monitoring, where if you have hypertension, we'll give you a blood pressure cuff. You take it home. Do your reading every day, press a button, it goes right to data into my computer in your name, so we have your blood pressure readings every day. It's genius. For diabetes, the glucometer, same thing. Whatever testing you're doing goes right to your program or your page in my computer, so we can track, call you, hey, you're doing great, keep up the low-carb diet, you've lost weight, your sugars are great. It's just a better one-on-one connection with the doctor, and we do telehealth visits and such, so that's a great way to keep track and prevent you from going to that big ER visit. Medicare doesn't want to spend $100,000 on the ER visit, so they're wanting us to keep better track of you to keep you in a better place. We also have smartwatches that'll check your oxygen and your rate and rhythm and heartbeat. So in the near future, I think it's going to go out to all patients as soon as the other insurance companies get smart, where you get up in the morning, have a glass of water, cup of tea, sit in a chair. There's going to be a chair that looks at your circulation. It's going to do a little EKG. It'll look at your pulse, your oxygen, your sugar, blood pressure. There's a device coming out of Switzerland where you wear glasses, and the sidebar on the glasses is reading brain speed, which will tell us whether or not you may have a higher risk for memory loss, dementia, or Alzheimer's. When they compare your test with a million other people through AI, you're getting a great comparison to see if you're predisposed to some sort of disease. But get up, go in, get your thing done. You wear a little device, a patch on your chest, pedal your exercise bike. It's a mini stress test. All goes to the doctor. And now we know you're in good shape and can keep you there. It's genius.
What's better than
Wish I would have thought of it.
It's genius.
Wish I would have invented it. But yeah, so we're doing a great deal of that for our Medicare patients. So for those of you who are interested, give us a call, 516-794-0404, and hit the website, drcalapai.com.
Beauty.
Awesome. Go Yankees. Did I forget to say that?
You did.
Go Yankees. Now, I can tell you with pretty significant certainty, and one of my good friends, Bob, who's the leader of our karate style, his dad used to work for the Yankees as a scout. So, yeah, great guy. His dad used to hang out with Mickey Mantle, Whitey Ford, Billy Martin and his dad were best friends, and would sit in the clubhouse with these guys. And when Bob was young, we used to run around and go shag the ball out in the field as a batting practice. So, and he's got Mantle and all these guys, gloves and baseballs and bats and cleats, all that stuff, which is pretty awesome. But I told him, because we used to go to a lot of games, I think I can control if the Yankees win or not. And he goes, what are you talking about? I said, if I turn the game on and I watch an inning or so, then I turn it off, or I leave the room and I go somewhere else and do not follow the game, they're going to win.
I'm the same way.
If I watch the game and try to watch it all the way through, they don't do anything. They can't hit when they need to hit. There's no home runs. Past couple of games and all the times that these big guns are hitting these home runs, I have to watch it on the recap because I'm not watching the game because I want them to win. And, you know, Judge is a gigantic guy. I've met him a couple times. He's gigantic and as big and as strong as anybody else you'd ever see. It's 6'8", and he can't be 285 pounds. He's got to be 300 pounds of just pure muscle. So when these guys hit the ball, it just goes. And he could slice the ball and hit it a third of off center, and the ball go to a home run in right field. But Stanton, he's just using his arms. He's just swinging with his upper body. He's not taking a big step. And the ball goes 400 feet and then to the second deck.
It's crazy.
I mean, the power there is just incredible. And you got Jazz and Wells and Grisham, you know, that are the clutch hitters, and they're all questionable. And can't forget Belly. The other outfielder, I forget his name, whose dad used to play for the Yankees.
Oh, yeah. It's okay. We
Slipped
have
my mind.
one more medical question for you, Doc.
Yeah.
Type 1 diabetic since age 12. I'm now 54 and have very little complications, but since switching from the insulin pump to manual injections, my blood pressure is up and down. Any suggestions?
Blood pressure or blood sugar?
Oh, blood sugar. I misread that.
So whenever we see type 1s or type 2s, same conversation. Number one, let's talk about cutting down your carbs, the foods you eat. Get rid of bread, rice, pasta, potatoes, oatmeal, grains, rice, etc. And there are a lot of good things you could have. I'm not saying you could never have them again, but try to keep the highest sugar and high glycemic index foods down or out of your diet, number one. Number two, exercise. You want to do at least a half hour to 45 minutes of something every day because that burns sugar, burns fat, delivers oxygen, vitamins, minerals, floods them to your cells. Number three, look at your hormone levels because in your 50s, your hormone levels aren't going to be good. You might see if we raise your testosterone from 400 to 600, you'll get a much better blood sugar reading. Correct your vitamins. There are vitamins that help to metabolize and burn up sugars and fats. And the other ultimately natural mechanism is stem cell therapy. Your pancreas is still connected. So we've had type 1s where we've done stem cell and their pancreas is now making some more of their own insulin. Whether they've gotten off their meds, some have, some haven't. But it's a lot better picture when everything with your sugar's nice and tight and we can prove that you're not getting damage to your nerves, your blood vessels. Glycation is damage from sugars inside your cells. So there's a lot to look at, not just looking at your sugar going up and down. So that's why we're more thorough with that. But yeah, that would be the best way to, look at the entire picture.
Just seeing if they have any follow-up.
And traditionally, doctors say, here are the meds. They don't show you and teach you how to do the diet or cook or to make this food, that food, substitute this for that. Not only do we have a low-carb diet handout, but I've got a full page, which I need to add to, of foods that you can get at Whole Foods and a lot of good places that are cauliflower rice instead of regular rice, or grain-free chips and wraps. Instead of oatmeal, you could have chia seeds, almond milk, and a protein powder that's a plant-based with no sugar. Whip it up, put it into the fridge, and you've got oatmeal. It looks and tastes like oatmeal when you take it out of the fridge. So there's a lot you can do to really add on to the benefits as opposed to just looking at one parameter. Lady I saw the other day makes a smoothie in the morning, and I'm like, okay, well, what's in it? Well, I have 2 tablespoons of honey. I said, whoa, it's a lot of sugar. Isn't honey good for you? I'm like, well, not if you're worried about your sugar, and she is. And then I said, what else? So I put stevia in it. You're putting stevia in it to make it taste sweet, but then you're adding honey to make it sweeter? And then half a banana. And then, she's having 100 grams of carb just within that smoothie. I'd rather you have the cashew milk yogurt from Forager Project at Whole Foods. Put some berries in it, still 1 gram of carb, no big deal. You could put the protein powder in it, no carb. You're getting good proteins and vitamins. Some people like to have greens. You could pop them in there. There's a lot of different things you could do, but you don't need to add all this other sugar. And you've got a great smoothie with no carb. That's what you want. Best way to do it.
What a beautiful fusion of medical and conspiracy and politics.
going back and forth.
And the
optimal health, political health program. Hey, I've said it before. We'll talk about anything you want to talk about.
Beautiful. And yeah,
we'll talk about the good old days. We do that now and then.
This is a great show. Said you can't watch it. You have to miss it. It's kind of like when my son played baseball. If his dad had to work, he was a beast. He even hit one over the fence when his dad was working.
Yeah, oh, my God.
Every time.
I can't believe he just said that.
It's so true.
I have a personal anecdote. So Little League was the greatest thing when I was a kid. And every guy, you play year after year, and it was just amazing. You see all your friends, and you get picked for a team, and the camaraderie, and those super hot flannel, stupid baseball outfits, and, it was just amazing. My dad and my uncle would come down to every single game. They came to every Memorial Day parade, everything, and took pictures all the time. Slides, video, so much so they called my dad ABC and my uncle NBC back in the day. Swear to God, truth. And my whole family still laughs and jokes around about it. One day I'm at Whalen Field, which is off Ocean Parkway near Malvern, and our team's playing another team. And we were playing a really good team. I think Malvern Bakery, which is a really good Little League team. They had the best players on it. They were all a little bit older within our age group, but still the same age. But these are the guys that were strong and fast and whatever. I get up, it's loaded bases. I'm looking around to see if my dad's here. He was driving home from work and trying to get to the game, as he always did. It was always there before we started. And now I get up to bat, and it's a little bit into the game, maybe second inning or something like that. And there's an opening, and you drive down, you park the car here. There's an opening, you park the car over there. I don't see my dad's car, Pontiac station wagon, 1972. Big blue 21-foot long station wagon. I'm like, oh, man, I get up next. So I go to get up. I'm like, oh, man. I'm like, well, man, what could happen? Loaded bases. I hit a couple foul balls.
You're on it.
I'm on the ball. I'm good. I'm concentrating. Kid throws a pitch, a beautiful fastball. I hit the fastball as hard as I could, swung as hard as I could, hit the ball into left field, goes into the trees for a grand slam.
Let's go.
My whole team is freaking out. Even one of my buddies, this guy on the team, Chris Moonisteri, we called him Mooney, big guy. He goes, "Come on, Cal, hit a home run, grand slam, come on." And I'm like, So I get up, I hit the grand slam, and I'm running around the bases. Our team is going crazy. I get to touch home plate, and I turn around, and I see my dad in the station wagon coming into the parking lot after I touched home plate. And the team is jumping around, and he gets out of the car, he's walking, he's looking, and the team is jumping around. They're hitting me, patting me on the back. I didn't want to look at him because I knew that he would be upset. He looks over me, he puts his hands like that. He went to, I don't know how many games over how many years we played. He walked over and was like, "Yeah, he hit a grand slam." And my dad's like, "Oh." All these years that I came to watch him play and practice and pitch the ball to me.
Work.
And I crush a grand slam and he didn't see it. So he's up in heaven laughing now, I'm sure. Because, it wasn't funny to him back then. Right. Hopefully it's funny to him now.
Right.
And my mom's laughing right now, I know.
The chat says, probably. "I know your dad hated to miss that."
Oh, man, yeah. That was the worst for him, I think. All that time and effort he put in. So, yeah. A lot of people have different, similar stories. But, yeah, it was a good time.
The good old days.
Well, thank you so much for watching and listening today. God bless you all. Have a wonderful day. We'll be back on again Monday. A lot of new stuff we're going to talk about. Always looking for new technology, new things to help to maximize and help people out. So we'll talk about all that. And we'll talk about doing a lecture.